Hello, my name is JonnaVe Stokes and I'm a member of the Joint Information Center. Today I have important updates regarding eligibility groups, a change in our vaccine scheduling process, next week's clinics, and recommendations from the CDC for fully vaccinated individuals. Last Friday, Governor Brown announced that Phase 1 Group 7 individuals would be eligible for COVID-19 vaccinations beginning April 5th. However, this Wednesday, Benton County received authorization to open up COVID-19 vaccine appointments early to the newly eligible group. Group 7 includes frontline workers, people living in a multi-generational household, and people 16 to 44 years of age with a qualifying underlying health condition. Also on Wednesday, the process for scheduling vaccine appointments changed. Benton County no longer requires individuals to complete the Vaccine Needs Assessment Survey. Utilizing this process in the early phases of our vaccinations was critical to prioritize individuals within eligible groups. Increased vaccine availability and appointments means that this step is no longer necessary. From this point forward, if you are eligible and would like to make an appointment, a live scheduling link is available on both the county's COVID-19 vaccine website and Samaritan Health Services COVID-19 vaccine website. Individuals will be asked to self-attest that they are eligible for the vaccine. Individuals without internet access can still continue to call Benton County for assistance with scheduling their vaccine appointment. We are extremely pleased to announce that Benton County, in collaboration with Oregon State University and Samaritan Health Services, hosted 3 more vaccination clinics Wednesday, yesterday, and today, administering over 5,500 doses. Today also marks the day that 30,000 doses of the COVID-19 vaccine have been administered, which is roughly 1/3 of Benton County's population. We are also pleased to announce that next Saturday, Benton County will host their first rural vaccine clinic in Alsea from 10 a.m. to 4 p.m. at the Alsea School. To schedule an appointment, eligible individuals can call Benton County at 541-766-6464 or visit the Alsea Health Center Clinic to make an appointment. In closing, we would like to share the CDC's vaccine protocols for fully vaccinated individuals. People are considered fully vaccinated 2 weeks after their second dose in a 2-dose series, such as Pfizer or Moderna vaccines, or 2 weeks after a single-dose vaccine, such as Johnson & Johnson's vaccine. The following are activities you can start to do if you've been fully vaccinated. You can gather indoors with fully vaccinated people without wearing a mask or staying 6 feet apart. You can gather indoors with unvaccinated people of any age from one other household, for example, visiting with relatives who all live together without masks or staying 6 feet apart, unless any of those people or anyone they live with has an increased risk for severe illness from COVID-19. If you travel within the U.S., you do not need to get tested before or after travel or self-quarantine after travel. You still need to pay close attention to the situation at your international destination before traveling outside the U.S. You do not need to get tested before leaving the U.S. unless your destination requires it. You still need to show a negative test result or documentation of recovery from COVID-19 before boarding a flight to the U.S. You should still get tested 3 to 5 days after international travel. You do not need to self-quarantine after arriving in the U.S. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. Thank you for your time, and we hope you have a wonderful weekend.